Now, in that vein, I will thank our guest speaker in advance for what she has done and what she does and what she will continue to do to make a difference in people's lives. For 30 years, she's been in the business of serving others. Her work touches directly some 600,000 people a year. And I suspect that by speaking, she touches millions of people a year. So in your program, you will see a little bit more of a description of Angela Blanchard, who is the president and CEO of Neighborhood Centers, Inc. I'd like to take a moment to share with you a different reflection of Angela. She's shared that she helps change makers and leaders turn passion into practical ways of changing the world. Action. As a nonprofit CEO, Angela has learned that leadership has nothing to do with position and everything to do with being present and productive in challenging situations. She teaches practical approaches to evolutionary leadership and proven frameworks for transforming communities and organizations. She knows how to keep the conversation and, most importantly, the action going. We still have a lot of work to do here in North Texas, and to help us to understand and reflect on her experiences engaging communities, family, and children, we are honored today to welcome Angela Blanchard, President and CEO of Neighborhood Centers in Houston, Texas. Please let's give her a Dallas, Collin County welcome.
Thank you.
Thank you.
That was great. Appreciate it. So that was the best commercial anyone's ever done for me. Thank you. I wish my boss was here to hear it. And I'm really, really glad to be here. Not just because if I was in Houston, you know, it'd be kind of wet right now. But I'm glad to be here because I'm always happy to be in the presence of people who have made a commitment to work together to create some change at a significant level. And I want to say a special thank you for Cheryl's willingness to organize a group to come and visit us in Houston. You made us feel so good. And so now I got to make a confession, because I used to start some of my talks when I was outside of Texas by making fun of Dallas. And you understand that. You do, because you know you've made fun of Houston. You have. And so I forgive you, so you have to forgive me too, right? So I want to talk today about leadership, and I'm talking about evolutionary leadership, and I'm Cajun. I just realized I haven't looked at this device, and is it going to work? That kind fellow behind the screen there, like the Wizard of Oz. So good. So I'm going to start and tell you a little bit about neighborhood centers, only because I really want you to know that I really, really did this. I didn't study it or write a book about it or read inspirational passages from other people's books and then come here to recite them to you. A lovely gentleman asked me earlier, he said, so what is your real job? Do you go around inspiring people? I'm like, no. It's called CEO. That's what I get paid for. So I'm the CEO of Neighborhood Centers, and we're a $250 million plus organization. We served over 500,000 people last year. And we've put ourselves in the top 1% of organizations in the country. And even though we're in Houston, we didn't get big just for the heck of it, though we do admire large organizations in Houston. And we're over 100 years old. We continue to reinvent ourselves for the city that we're in now. So here's what's going on at Neighborhood Centers. We have 5 community centers. We have 11 career centers. We have tax centers, senior centers, because we learned a long time ago that really bringing about change means you have to work on all aspects of what makes a neighborhood and community strong. It doesn't really work just to do one part of it. So we've been willing to wade into the difficult and challenging waters and complexity of working on multiple things at multiple times. And we're doing that in counties across Texas, but most of our work is in the Houston area. So we've gotten a bit famous, and one of the things that made us famous is this project, Baker Ripley, and some of you have seen it. So when we were thinking about building Baker Ripley, people made encouraging comments. They've probably said some encouraging things to all of you about your work in the Alliance. And this one lovely gentleman that works at the city of Houston looked at our plans and said that has a snowball's chance in hell of ever being built. You know how we say that in Texas. Every word is 3 syllables long. And hell was a real long word when he said it. And while he was pronouncing that, I had time to think about just what we were going to do. So this was the Snowball's Chance in Hell project, a 5-building, 4-acre site in the heart of Houston's most diverse community. And that site has a clinic and a library and an elementary school, and it has immigration services. And because it was an unbanked community, it also has a credit union, and it has a tax center. And all of that comes together every day in a site that saw more than 35,000 people last year. Now, before this was built, this area in Houston was referred to as the Gulfton Ghetto. You drove around it, not through it, and police like to talk about it in this way. Well, we don't really want to go there. We kind of wait for them to throw the bodies out. So instead, what we saw was a community full of hunger and hope, with a lot of a deep, desperate desire to make their lives better and those of their children. We saw people that had come from countries all over the world, or as I like to say, sometimes whether you have to cross the tracks or the river or the ocean for an opportunity, they had found their way to Gulfton because the housing was inexpensive. And they were all there desperately trying to make it, and the city kept driving around them. So we went out into Gulfton with a new set of questions. And those questions were radically different than things that had been asked before. Because we did our work in a very different way, the world began to take notice, and people have since written books about us and articles, and we've gotten very famous, and I'm going to tell you what for. These were the 4 big lessons. These are the 4 big innovations for which we've received great acknowledgement. We've hosted visitors from Australia. We've been to South Africa and to the UK to talk about this work because it radically changes your ability not only to change communities and to transform neighborhoods and lives, but it radically changes your ability to sustain yourself in the work and to keep yourself going in the time it takes to make a meaningful difference. So, building on strengths and aspirations, leverage public and private resources. Well, I just like to say, milk every cow, right? I'll explain more about that later. 3 is be holistic. Don't try to do this in one-dimensional. You all already understand it. The beauty of health and medical science is that it's taught you about systems, and you understand things as being part of a whole. So you know that to change it, you must look at the whole and see that system and how it operates so that you know how to invest to make a difference. And then the 4th thing is we've learned at neighborhood centers that we have to be big and small at the same time. At the level of the neighborhood, no one needs to understand how vast is the children's health system here. They just need to know that there's a promotor in their neighborhood that they can reach if they have a question or help. So learning to be big and small at the same time, these are the 4 lessons. So where do we begin? Ordinarily, when we want to help a poor community, we have this brilliant way of doing things for decades in this country. Now, I can say whatever I want. I grew up in one of those neighborhoods, and I've worked in them for 30 years. I know what we do. We do a needs assessment. In fact, we pile them up. We have needs assessments this high, and believe me, at neighborhood centers, we're still doing them. We turn those in as if our life depended upon it, or at least our funding, and it does. But you know what? We don't really believe that. We just believe that's part of the story, and it's the rest of the story we're really interested in. It's not the lacks, gaps, needs, wants, everything that's broken, because that won't get you far. You can't build on broken. None of us would have ever gone to college if we had been sent an application and said, please outline all the ways in which you are screwed up. Please make a list of the things that you're doing poorly and document everything that's missing in your life. We'll consider you. So we wouldn't think of that. When we interview people, do we say, tell us about every time you ever screwed up in every job you've had. Please document that thoroughly. No, we expect to receive a resume that highlights accomplishments. And when we look at communities and neighborhoods where poverty exists, and we see the struggle of the people there, even those of us who are completely well-intentioned and what we really want to do is help, we start first by diagnosing. We find everything we can wrong with it, and we pile the paper up really, really high because we really think that's the message, that's the case that's going to engage outside help and fix the problem. And those have largely not worked. It's not that they helped no one, it's just that they never really brought about a really big change because you really can't build on what's broken. So we say the change begins with the first new question. It's not what's broken here, but what's working. It's not what's wrong, but what's strong. It's the things and the practices and the policies and the people and the leaders in the community that are already doing it well. So when we go into a neighborhood, and by the way, at neighborhood centers, we have a sort of the prime directive. We go where we're invited. We do what we're asked to do. Because help can't be a form of aggression. So if we stand outside your community and decide you're just not getting it right, and we'll be there tomorrow to show you how you ought to live, it's kind of like if somebody showed up, knocked on your door, came in your living room, sat down, and told you how you ought to arrange your furniture. You wouldn't really like them very much. Even if you had planned to rearrange your furniture, you wouldn't appreciate that kind of uninvited help. So we believe in go where you're invited, do what you're asked to do. And the questions we start with, and this isn't a superficial exercise. By the way, this isn't positive thinking. We only work in the most troubled places with the most complex issues and the most challenging situations. So we're not putting a positive spin on pain. We're actually in front of people in their communities and neighborhoods saying, you know, one way or another, you're making it work here. You're raising your children here. You're supporting one another here. You're caring for your elderly neighbors here. You're finding a way to get to work here. How is that happening? What is it that really makes this neighborhood strong? What's enabled you to get these important things done in your life in this community? Who cares and who leads? And when we understand that picture of community, now we know what to resource and support. If you know what people themselves value most, what they'll do anything to accomplish, then you don't have to worry about motivating them to come to your program because you build the program around that which they care most deeply about. So I've had a big national consulting firm call me up and said, we're working with these fabulous health organizations and they've designed some great evidence-based programs and they just can't get people to come. And I said, well, did you ask the people if that was the program they wanted? Well, no, but they really need it. I know, but did you ask them first? So the conversation, by the way, this doesn't mean that we leave people in ignorance. It doesn't mean we ask them, and if they don't say they need this help, we never offer it. But it means that we begin with what matters most to them. So in Gulfton, for example, we were dealing with people who've traveled thousands of miles and taken over a decade through one refugee camp and unfriendly country after another to arrive in Houston for their children. Yes, they needed to learn English. Yes, they needed job training, but they came for their children. We started everything initially built around their children. Now, a few years later, of course, we're working with them on all the other things. But we started with what mattered most to them, what hopes and dreams they had for their kids, and we listened. So what you saw at Baker Ripley in the 5-building, 4-acre site, paid for by the rest of the city, private philanthropy built it in Houston. In the middle of the nastiest, ugliest debate on immigration ever, everybody, as my board chair says, wrote a check for something they wouldn't vote for in a million years. That's what I call good fundraising. Now, you understand, right? You can't get people to vote for stuff that you can get them to do. And that, you got to work with what you got, right? So now I didn't put this slide in here this morning just because Houston actually looks like this right now. But I put it in here because I remind my team all the time, no one's coming. Because you're sitting in a role, you've got resources and power, you've got opportunity and responsibility. But in each one of us is some small part of us that thinks there's somebody bigger, better, smarter. Well, you might have a couple people in here that, have healthier egos. But most of us actually feel like we're not up to this, that this is bigger and more complicated and might take longer than we really can do. So I tell everyone, no one's coming. There's nobody else. It's you. You're in the room now, and you can do it. Because any part of you holding on to the idea, for example, that our governor is going to actually get it right on Medicaid, that's not going to happen. We are specializing right now in this state in a form of ignorance that's downright irritating. And we've even exported it to the rest of the country. The political arena is not going to help you. So you can't wait for that. And I remember when I was working early on things like immigration reform, because I like to do the impossible a part of every day. And we can't get that to work. So it doesn't mean we quit. It doesn't mean you sit and wait. It means that we do what we can with what we have, where we are. And this was somebody smarter than me, but I added right now. Right now. And in every organization, in every community in this room, an enormous amount of brain power and commitment and resources and assets. And when you agree to come together to try to deploy those in a smarter, more coordinated, more impactful way, you're going to make a big difference. And when you, moreover, go out to tell the story in a way that isn't about everything that's wrong with the communities you're trying to help, but it's also about what they represent in terms of the region and what they mean to your city and to the state. When you tell that story, then you have much more success, and the success lasts longer, and you can sustain yourself in it. So the practice of beginning with what's right, what you did today, what Eduardo encouraged, and your acknowledgement of the progress you've made is essential. But it starts with all of us taking what we're already in charge of. I really love to go ask for resources. It's actually really fun. In what other world but the nonprofit world do you go into someone's office and you say to them, have I got a deal for you? Here's a great idea. I just typed it all up nicely for you. It's not going to benefit you at all. But I want you to write a check for it for a few years in a row. And they do it. Isn't that great? I mean, it's the kind of country we live in where this doesn't happen in every country, where people are willing to give resources to things that don't directly benefit them. But you're a caring community, and you really want to see everyone make it. And when you go out with that story about how we're connected, since we got famous, I've gotten to be in a lot of cities. And I've seen the cities that had an idea that they could move forward without this neighborhood or that neighborhood. in some part of their thinking, we just set them aside and we go forward. And those are really cruelly sad places to be, because when the check comes due, it's really expensive. Hopelessness and despair breed two things: rage or just giving up. And both of those are very, very expensive. So the fact that you care enough to look across your city and make sure everyone is included is a huge thing. And that's something in Texas we can brag about. So my little clicker quit working. So I'm talking about circles of support because Cheryl reminded me that this is a real important part of what they liked learning from us when they came. This is the, milk every cow, but I made it fancier. But there's an important lesson here. There are organizations that really like to say we don't fool with public support. We want a privately supported thing. There are other organizations funded by public support, not able to access private support. But honestly, over 3 decades, I can tell you that those things that go on having a life, the program, the organization, and so forth, really get very adept at bringing in all these elements and weaving the funding together the way you want to weave the program together. And I want to say one more thing is I think it's a very important lesson for those of you in nonprofits. Largely in the nonprofit sector, we often think that we can't begin anything new until another check arrives. But what we must do instead is take the most flexible resources we have and deploy them toward this edge. And the edge is experimentation, innovation, integration. That's what the edge looks like in the nonprofit sector. And so you start with the resources you already have to move those to the collaborative efforts, move those to the integrative efforts, and you start with the flexible dollars. I know what it's like to manage a large amount of government funds. We don't get, well, unless you want to go to jail. And then, of course, you can be experimental with federal dollars. If you don't want to go to jail, it'd be best not to experiment with those dollars because they usually come with a very specific set of instructions. Follow those. But still, in your organization, you have the obligation to take those flexible funds, put them to work on the things that are going to make a difference in the future, the actual experimentation and innovation that's needed to have a breakthrough. So I can give you more on that. There's a tiny video, real basic on my website. You're all welcome to look at it. But this is a really important thing because everything is a dream if you can't finance it, right? It's just a dream if you can't finance it. And we are not going to wait, because we know no one's coming, for the world to integrate its funding and to take the kinds of approaches and the allocations of dollars that we know work best. We can't wait for that. So we have to do that. That's the alchemy you perform within this collaboration, is to take all of those different resources and make them align in terms of impact. Okay, and when you've done it, let me tell you what's going to happen. Well, a couple people will write a book about you. A whole lot of people are going to come up and tell you how you didn't get it right. I want you to be prepared for this. I was not. I was real excited. I thought other people were doing fabulous work and we were doing fabulous work, and I just couldn't wait to get out there and share. And then I met this guy. I'm calling him Goldman guy because he worked for Goldman Sachs, and they have healthy egos there. And they fund projects like neighborhood centers. And when he met me, he said, at the Clinton Global Initiative, where there's more talking than you've ever seen in one place in your whole life, a lot of talking there. So, and he met me and he said, oh, I've heard about your center. And I said, oh, okay, which one? He said, oh, well, the center. And I said, okay. And he said, but the problem with that is, so I want you to be prepared for those people. Because while you're in the middle of doing this work, people will helpfully tell you how it won't work, doesn't matter, inscalable, won't ever be funded, the private sector won't support it, the public sector, all the things you're doing, they'll be telling you how it ain't happening while you're doing it. You can't pay any attention to this, I promise. You learn quickly enough, they're not going to help you, they're not going to fund you. while you're on this endeavor, where you're honoring the commitment you've made to one another to see this collaboration through, you have to ignore those voices because they're not on the team. And you have to go again and again to one another in ways that build trust because you want to sustain yourself through a long process of making a profound difference in your community. And don't worry too much about all of that. They're just writing policy about and studying it. They don't have the joy that you have to see it working and that to know that no change is too small for a child's day to be different because their inhaler works better. This all matters. Whenever I got finished with Goldman Guy, then the final thing, it said, now where is it? And I would say Houston, and this would be the response, oh. Because nothing that happens down here could ever be a lesson for any place else in the country. Now, if you didn't know that already, let me just tell you, innovation happens in San Francisco, Washington, D.C., Chicago, and New York. Nowhere else. So if you do something remarkable, it doesn't matter. It's just kind of like like the tree that fell in the forest. It never even happened. Don't let that get you down. 70%, by the way, of the children born in the United States in the next 10 years will be born in a fast-growing western or southern city. We are raising the future in your city and in my city. We have a huge responsibility to shape what this country can be. And we're doing that through the work that you're doing now. And if the rest of them don't get it, I hate to say it, but they're getting old up there, you know what I mean? There's just going to be a lot more of us, you know? So we do good work because we do good work. Now, I have really passionate, motivated team members, and it just breaks their hearts sometimes that things don't work out well. You do great work, and then you get some lunatic legislator or some knuckleheaded congressman who decides that, they've got a better idea, and they wreck your entire agenda. They just decide that program that's working so well out of Department of Education should just move on over to the Workforce Commission that doesn't know anything about it, doesn't care about it, and you're left trying to figure that out. So I say this because it's really important when you deeply care about community. We do good work because we do good work. The lasting change you seek, you may see a lot of that happen, but you may only see small things happen. And these are the kiddos that I keep in mind every day when I go to work, because these 3 kiddos are in 5th grade now. I think this was their 1st grade picture. And in that particular classroom, we have 32 countries of origin in Baker Ripley's school, 200 kids. These kids have been together now since preschool. They know one another's stories. They've been there for one another. Their parents have learned to be close and in community, even though they came from countries at war with one another. The only world they know is the world of Baker Ripley. And I'm pretty sure you remember your best friend in 5th grade, and you remember your 5th grade teacher. And what we have done with those children is permanent. So the system change you seek and the result of the grand collaboration, it may take time or you may not ever see it. But individual lives will be reshaped by the work you do, and that's lasting. So that's all I got. The rest is up to you. So.